Dr. Williams, how are we going to get rid of diabetes? Great questions. Hi, I'm Dr. Gabrielle Williams of Gateway Direct Health, and this is part 2 of our series of diabetes. What is it? We talked about last time that diabetes is a disease of the sugar and insulin. Our type 1 diabetics don't produce insulin, and type 2 diabetics are not able to use the insulin that they do produce because of various reasons. And so now we'll discuss, well, how do we get rid of diabetes? Is there a cure? What is pre-diabetes? And if we do need medications, what are the common medications for diabetes? For normal sugar, typically is less than 130, right? So normal sugar is typically less than 130. As we get older, we want to tolerate higher sugars because we can't tolerate low sugars. As we get older, lower sugars are maybe in the 90s and 100s, and we start to feel woozy and dizzy, and what we don't want is for people to fall. And so in elderly, we tolerate higher sugars like in the 150s. So now diabetes is when your fasting sugars, that means you haven't eaten anything, are above 126, or if someone were to check a random sugar, it's in the 200s and you have mild symptoms or major symptoms, or your A1C, like we talked about last time, is above 6.5. Now, pre-diabetes is 5.7 to 6.4. Now, how are we gonna get rid of diabetes? Listen, okay? Diet, exercise are integral parts of treatment for diabetes. Lifestyle, healthy habit changes are very important for diabetes, pre-diabetes and full-blown diabetes. So when we get to sugars of A1Cs, of 5.7 to 6.4, we're in the pre-diabetes range. This is where we need to be aggressive. We need to be aggressive, be aggressive. You hear me? So that means cutting out carbs, not necessarily eliminating them, but cutting out carbs, decreasing sugar intake, replacing our white rice with brown rice, our white pasta with whole wheat pasta or zucchini pasta, replacing potatoes with a different vegetable because we know that those are really high in carbohydrates and sometimes tend to have less fiber, right? Our brown rice has more fiber than white rice. And we know that fiber is very important when it comes to carbohydrates and processing them because fiber helps us to process them better and have fewer sugar spikes. With diabetes, when we have really high sugar spikes is where we have issues, a lot of issues. And so in addition to healthy diet, it's very important to exercise, physical activity, movement. Not necessarily that you have to get a gym membership, but it does mean that we are moving our bodies and saying bye-bye to the sedentary lifestyle. That means we are parking way in the back of the store parking lot and walking in the store. We're going around the store, especially on the perimeter, because that's where you'll find your fresh fruits and vegetables. Also, we are taking the stairs instead of the elevator and the escalator so that we can increase our energy expenditure, right? So that we can increase how much energy that we're using up. In addition to making those changes, household work, right? Those are also considered moderate level activity, like not necessarily using the riding mower, but using the push mower, right? And making sure to get out there, for a few minutes, hours to cut the grass. And it's a nice workout. I know everyone knows that, right? In addition to that, cleaning the windows, right? So you're moving up and down, you're moving your arms up and down, moving side to side to clean the windows. That is a level of physical activity. Mopping, sweeping, all levels of considered physical activity. Now, you can get a gym membership if you want to. The American Heart Association recommends to keep our hearts healthy to exercise 150 minutes a week. So that's 30 minutes 5 days a week. And despite us having 24 hours in a day, it still is hard to find 30 minutes, but doing something is better than nothing, right? And so even if it means having to break up your 30 minutes into 3 10-minute segments, right? Let's say you're working from home and you take a 10-minute break to walk the neighborhood or do a quick jog. That is activity. Even if you do 10 minutes once a day, that is still better than not moving at all. That also may mean instead of having a sitting down desk to do computer work, having a stand-up desk, right? And so standing up, you use up more energy. If you are at work and you're not working from home, taking those breaks again to move around, maybe before lunch, walking around the complex, moving your arms, getting your knees up high, again, expending more energy, using your muscles, because when our muscles use the sugar, and that's a great way to use up sugar, right? And not just converting it to fat, but our muscles are using it as energy and getting rid of it. And so in addition to healthy diet, exercise, guys, lowering our stress level. That is very important for diabetes management. I know you're like, wait, well, how is stress related? Well, when we're really stressful, our body's releasing a hormone called cortisol. And cortisol is like our fight or flight hormone. It's like ready to go, right? It's ready for us to move. And so because of that, it raises our sugar level so that our body can use that sugar for energy. However, we're not in a state of physical like fight or flight, but more mental. It's still, the body recognizes still as stress, feels like it needs to do something, and so our cortisol levels raise, and so do our sugars. And so managing our stress is very important. Now, for some people, it may mean leaving the job because it's causing too much detrimental effects to the body. Not everyone can leave their job, so just managing how we manage the stress. So a big thing I promote is having boundaries, right? You have a role to do, you put a boundary around that rule. It's very easy for employers to try to add more to your plate, especially if you're a great stellar employee. However, if you find that it is causing undue stress, causing more conflict, internal and external, it may mean to let go of some of those duties or delegating so that you can maintain your peace in the work environment. Also, stress levels at home. It may mean marital counseling is important, right? To lower our stress, to get a mediator to discuss any marital issues, or family counselor to discuss family issues so that our stress level is decreased because we are managing it well. Yes, I know, stress. Next is sleep. It is very important to get your sleep. Again, if you're not sleeping well, you are increasing your stress level. Your body's like, okay, what are we doing? What do we need to do? And so that can raise our sugar level. So making sure to get adequate sleep 7 to 8 hours a night, right? 7 to 8 hours a night. So those are just a few ways that we can manage diabetes or pre-diabetes without medications. Now, sometimes we can do all of those things and still our sugar levels are too high and we may require medications. Most common medication we prescribe is something called metformin. Metformin is a great medication for diabetes. It's been around for a very long time. It decreases our risk of heart disease. Yes, it does have that great effect. I know that it's been in the news because there might be some impurities in there from a pharmaceutical production standpoint that are associated with cancer, but metformin by itself is not associated with cancer. So in addition to metformin, there are medications called sulfonylureas like glipizide, glimepiride, and they help to decrease your sugar levels. There's also insulin, everyone's favorite, just kidding, but insulin is to help get our sugars down, again, move that sugar from the blood into the body. And so some patients with type 2 diabetes may need insulin because sometimes our sugars get that high from our pancreas not being able to regulate our sugars well. It may be from family history of really bad uncontrolled diabetes, or not able to do the lifestyle changes because of disability or whatever. But sometimes insulin is necessary, right? And so when our sugars are really high, it is necessary to take insulin. Now, in addition to insulin as an injectable, we have GLP-1s like Ozempic, Mounjaro. Those medications tells our stomach, hey, we are full, and so we decrease how much calories that we're taking in, and that helps with weight loss as well as monitoring our sugars. And then there's a whole host of other oral medications for diabetes, but those are the metformin, sulfonylureas are the common oral medications. We have insulin as an injectable, and we also have Ozempic, Mounjaro, the GLP-1s that are injectables for helping with diabetes. It's very important to have lifestyle healthy habits at baseline. That is the foundation for treatment for any disease, including diabetes, including cancer, including heart disease, is having those healthy lifestyle habits. So the things that we talked about were healthy diet, exercise, adequate sleep, managing our stress. And so those are the foundation. Now, if we need medications to lower our sugars because we know that diabetes has detrimental effects on the body. And so, it may be important to speak with your physician if your sugars are still not coming down despite doing all the things, to maybe see a nutritionist and to maybe start medications. It could be oral medications or injections. So I hope that this has encouraged you and given you a new perspective of how diabetes can be managed without medications. Again, if it's necessary, it's necessary, but there are things that you can do, things that you can control to keep your sugars controlled. Thank you so much for listening to the episode. If you are loving it, make sure to like, comment, follow, and subscribe, and I'll see you next time.